Welcome back to my channel. If you are visiting this space for the first time, you're also highly welcome. In this lecture, we'll be looking at the histology of the cervix. I put up a lecture on the gross anatomy of the cervix. If you've not checked up that lecture, please kindly go and do so. But for the purpose of this class, we would be focusing on the microscopic anatomy of the cervix. Using this image by the side, this is where we have the cervix here, carried in red. The cervix is the inferior narrow region of the uterus. And if you take a portion of this region and you process it into histological section, this is the kind of configuration that you would see. In this lecture, we would be highlighting the different layers of the cervix, and we'll be relating their features with the functions that they perform. The cervix is a fibromuscular organ that is seen at the inferior region of the uterus. It is a dynamic organ in terms of its histological configuration. Using this image by the side, this is where we have the cervix carved out in green. We say that it is the inferior region of the uterus. And this upper region of the uterus that is harrowed in blue is the fundus. If you go more inferiorly here, that is harrowed in red, we have the body of the uterus. Inferior to the body, we have a constricted region that is harrowed in black, and this is referred to as the isthmus. Inferior to the isthmus is where we have the cervix, and this is the cervix here, carved out in green. And if you go more inferiorly to the cervix, we then have the vaginal canal. It is the vaginal canal that finally opens into the external environment. And if you look deep into the cervix, you see that a region of the cervix protrudes into the upper region of the vagina. This is where we say we have the vaginal canal. And if you look deep around this region that is carved out in green, you see that there is a region of this cervix that protrudes or enters into the vaginal canal. And it is onto this basis that the cervix is further subdivided into its two subregions. So creating the demarcation at this point here, we have the cervix subdivided into the ectocervix and also the endocervix. So this is where we have the endocervix here that is harrowed in blue. This is the region of the cervix that is located at this upper end. While if you go more inferiorly, we have the ectocervix or the exocervix. This region is what is harrowed there at this inferior region. And if you look deep, you see that this ecto or the exocervix is a region of the cervix that protrudes into the vaginal canal. So this is how we have the different sub-regions of the cervix. And these two sub-regions are distinct in terms of their histological features. By the time we drive through this lecture and establishing the different features that they present microscopically, you see that they are different. And if you take the two sub-regions together as the cervix, you see that the cervix in its entire histological configuration is also different from the histology of the uterus. This is where we say that the cervix can be taken as a separate organ because it is different in terms of its microscopic anatomy. So if you take a region of the cervix and process it, you'll be having the outer serosal layer, and deep to the outer serosal layer, you will be having the muscular layer, while the deepest layer, which is the mucosal layer, will be seen at the most interior region. So these are the three sub-layers that will be seen after processing a portion of the cervix into histological section. We'll be taking each of these sub-regions one after the other and describing what they present. We'll also be relating what we see in their histological presentation with the functions that they exhibit. So let's look at the outer layer. The outer serosal layer is made up of mesothelium, and it is seen to be continuous with the perimetrium of the uterus. If you go back to our lecture on the histology of the uterus, we say that uterus is made up of three distinct layers. We have the perimetrium, we have the myometrium, and we have the endometrium. For the perimetrium, we say that it is a continuation of the outer peritoneal covering of the uterus. And we'll be dwelling more on this as we go through with this slide. But just for us to know at this point that the outer layer, which is the serosal layer, is structurally made up of simple squamous type of epithelium in mesh of connective tissue. So you have simple squamous cells, which are flat cells, merged in connective tissue. This is what you see in the outer covering of the cervix. This outer serosal layer is not seen in the entire region of the cervix, and would be explaining this. If we try to use this lower image, this is where we have the uterus. This is specifically the body of the uterus. And at this region that is harrowed in blue is where we have the constricted region that is referred to as the isthmus. This isthmus is what creates the limit of the peritoneal covering of the uterus. If you look at this uterus deeply, you see that it is covered with peritoneum. And at this inferior region that is constricted is where we have the limit of this peritoneal covering. So at this point, we have the peritoneum then extending to the structure that is located anterior to it. And this is the urinary bladder. Remember, we described that the uterus is sandwiched between the urinary bladder anteriorly and also the rectum posteriorly. So in the anterior region here, we have the urinary bladder. And this is where we then have the extension of this peritoneal covering over the base of the urinary bladder. And this is where it forms the vesico-uterine pouch or the uterovesical pouch. We've tried to describe this in our previous lecture on the uterus. You can also go and check that lecture up. So you see that this peritoneal covering is now extending to the inferior region here, which is referred to as the cervix. This is where we have the cervix at this inferior region. So we should not expect to see the outer serosal layer if a section of the anterior portion of the cervix is processed histologically, because the peritoneal covering is not seen to extend up to this region. It is seen to be limited to the upper constricted region that is referred to as the isthmus. So if you process this inferior region, which is the cervix, specifically in the anterior part, we should not expect to see the outer serosal layer. But if you process the posterior region of the cervix, we should expect to see the outer serosal layer, because peritoneal covering at the posterior region is seen to extend to the posterior surface of the cervix. So let's try and use this upper image to illustrate this. In this upper image, this is where we have the extension of the peritoneal covering here. If you go back to the anterior extension, you see that it is limited around this region where this arrow is pointing, and this is the isthmus. But if you go more posteriorly, you see that it extends further down, even up to the level where we have the vaginal fornix. This is where we have the vaginal canal here. So the extension of the peritoneal covering posteriorly goes more inferiorly when compared to the anterior region. So if you take an extraction of the cervix around the posterior region, we should expect to see the outer serosal layer. And this is what is presented here in this image. So it depends on the specific region of the cervix that is processed histologically. So the second region is the muscular layer. This muscular layer is seen after the outer serosal layer, depending on the region that is processed. And this region is seen to be thick. And this is the region here carved out in black. And it is structurally made up of smooth muscle fibers. The smooth muscles deposit around this muscular layer is small when you compare it to the histological section of the uterus. Remember in our lecture on the histology of the uterus, we discussed in that lecture that the muscular layer of the uterus is seen to also be further subdivided into 3 subregions. But considering the muscular layer of the cervix, the smooth muscle deposit is small when compared with that of the histology of the uterus. So you see this in addition with the dense irregular connective tissue, rich in collagen and also elastic fibers. So you see the chunk of the muscular layer being filled with dense irregular connective tissue. You just have a small portion of smooth muscle fibers. This put together will form the muscular layer, and this is what is carved out here in black. The collagen fibers are seen to provide rigidity of the cervix. We said that during pregnancy, there is expansion of the uterus. This expansion is to accommodate the developing fetus. The expansion is not seen to extend down to the region of the cervix. The rigidity that is provided by the cervix is as a result of the collagen fibers that are deposited in the muscular layer. This is seen to help hold the cervix in place and preventing it from expansion. So the elastic deposit is responsible for dilation of the cervix during vaginal birth. We know that during vaginal birth, the cervix needs to expand or dilate so as to accommodate the head of the baby. We see that deposit of the different fibers exhibits different functions. But all in all, it is important that we know that expansion that occurs during pregnancy is not seen to extend to the cervix. And this is also a way where the cervix is also different from the uterus. And we can try to justify this using the histological presentation. So going through the muscular layer, we can now say that this layer is seen to be replacing the uterine myometrium. We know that the myometrial layer of the uterus is the middle muscular layer, and this is what is replacing it in the cervical region. And this is specifically made up of a small collection of smooth muscle fibers that are deposited in a dense irregular connective tissue, as we have highlighted. So it's important that we're able to differentiate the histological composition of the muscular layer of the uterus and also the cervix. So now let's drive through the mucosal layer. The mucosal layer is the innermost layer, and it is seen to be lining the lumen of the cervix. This region is not seen to be shed during menstruation. If you go back to menstrual cycle, during the process of menstruation, the shedding of the endometrium lining in the uterus is not extending to the mucosal lining of the cervix. So the mucosal lining of the cervix is not shed during menstruation. If you look at this lower image, this is the mucosal layer of the cervix, and this is what is carved out here in black. Remember, we said that the cervix has different subregions. If you carve out the cervix around this upper image, this is where we have the endocervix here, arrowed in blue. And inferiorly, we have the exocervix or the ectocervix. We already described the basis behind this subdivision. We said that region of the cervix is seen to extend into the vaginal canal, and this is what brings about the subdivision. So a region of the cervix that is seen within the vaginal canal is the ectocervix or the exocervix, while the region that is located at this upper region is the endocervix. And inferiorly here, we have the vaginal canal. Then the next sub-region of the cervix is the transformation zone. The transformation zone is the point where the mucosal lining the endocervix becomes the exocervix. So we have three sub-regions of the cervix, and the mucosal lining the different sub-regions are different. So if you look at this region that is demarcated here in dotted white, is the mucosal lining the endocervix. This is where we say we have the endocervix. So the mucosal layer of the endocervix is what is highlighted here in white, and this is different from the mucosal lining the ectocervix or the exocervix. And this is what is highlighted here in dotted blue. And at this point that is arrowed in black is where we have the transformation zone. So we see that the mucosal lining, the different sub-regions of the cervix are different. So we'll be taking the mucosal lining of the cervix in respect to their different sub-regions. So first, we'll be looking at the mucosal lining the endocervix, which is referred to as the endocervical mucosa. We say that this is where we have the cervix here, carved out in green. This cervix at this upper region is where we have the endocervix, and this is what is arrowed here in blue. At the inferior region here, we say we have the ectocervix or the exocervix. We say that this is the region of the cervix that is seen to extend into the vaginal canal. And at this region that is arrowed in black is where we have the endocervical canal. This endocervical canal is a canal or a lumen that is created along the endocervix. And this is what is arrowed here in black. This endocervical canal is guided superiorly and inferiorly by the internal and the external orifices. So you have the internal hose here creating a superior boundary or border to the endocervical canal, while you have the external hose here creating the inferior border or limit to the endocervical canal. So these are the structures that guide it superiorly and also inferiorly. And we say that the endocervical canal is a lumen that is created along the endocervix. We already established where the endocervix is created. So for the mucosal lining, it is made up of simple columnar type of epithelium. And this is underlined by the lamina propria. The lamina propria is seen to contain the endocervical glands. So if you go back to this upper image, this is where we have the lining here, or the mucosal lining of the endocervix. This is what is highlighted here in dotted white. We try to use this lower image. This is where we have the mucosal layer of the endocervix. Remember, this region here is the muscular layer. We say that the muscle fibers deposited here are small. What we have here are majorly dense, irregular type of connective tissue that is rich in both collagen and also elastic fibers. We tried to describe this in our previous slide. So for the mucosal lining, which is specific to the endocervix, we say that we would be taking each of the sub-regions one after the other. So for the endocervix, the mucosal lining is seen to be structurally made up of a simple columnar type of epithelium that is underlined by the lamina propria. So this is where we have the simple columnar type of epithelium here, carried in black. This is a single layer of columnar shaped cell. And this is what is harrowed at this point. This simple columnar type of epithelium can be glandular and also ciliated. They are ciliated at the upper region of the endocervix, and this is where they are helping to enhance movement across this region. While glandular type of simple columnar type of epithelium assume secretory function, and this is where they are able to secrete mucus within the cervical lumen. So you see that the basic epithelium lining around the endocervix is a simple columnar type of epithelium. And underlying this simple columnar type of epithelium, we have the lamina propria. And this is what is carved out here in dotted yellow. We know that the lamina propria is a loose type of connective tissue, and it is seen to be embedded with endocervical glands. And this is what is harrowed here in blue. So you have the endocervical glands that are highly influenced by hormones. They tend to secrete fluid into the endocervical canal. And the fluid that is secreted mainly is to enhance the movement of sperm cells. In response to estrogen, the endocervical glands secrete watery and slippery fluid so as to enhance the movement of the sperm cell along its lumen. So in order to facilitate the movement of the sperm cell, they secrete watery and also slippery fluid that will enhance their movement. The secret is also to lubricate the internal wall or the lumen of the endocervix. So you see that these glands are not there for fun or fancy, but they are there to secrete fluid that will help enhance reproductive processes. So let's dive into the mucosal lining of the exocervix, which is referred to as the exocervical mucosa or the ectocervical mucosa. Using this image, this is where we have the cervix. We say that at the upper region, we have the endocervix. We've tried to describe the mucosal lining of the endocervix, and this is what is demarcated here in dotted white. At this inferior region, we have the ectocervix or the exocervix. We say that this is the region of the cervix that protrudes into the vaginal canal. It also has its own mucosal lining, which is different from that of the endocervix. It is seen to be made up of non-keratinized stratified squamous type of epithelium. And if you look at this lower image, this is where we have the stratified squamous type of epithelium carved out here at this point. This stratified squamous type of epithelium is seen to be continuous with the epithelium lining the vaginal canal. Remember, we said that the exocervix is seen to protrude into the vaginal canal. So you see that the same epithelium lining the vaginal canal is what is also seen to be lining the exocervix because it is located in the same region. So if you go back to the endocervix, we say that the mucosal lining is a simple columnar type of epithelium. This is also the same type of epithelium that is lining the internal wall of the uterus. So you see that the epithelium lining is continuous with the structure that is located close to them. So for the exocervix, it is made up of non-keratinized stratified squamous type of epithelium, which means that we have flat cells that are in multiple layers. And this is what is projected here in this lower image. This stratification takes about 20 layers, but it can further be subdivided into 4 groups. So we have from deep to the superficial, we have the basal layer. The basal layer is what is carved out here in white. This basal layer is the deepest layer, and it is usually in a single file. It is a regenerating layer. This is the layer that further divides and become mature as they go more superficially. And more superficial to the basal layer, we have the parabasal layer. This is the parabasal layer that is carved out here in blue. This is seen more superficial to the basal layer. And if you go more superficially, you have the intermediate layer. This is the intermediate layer here carved out in green. This intermediate layer are beginning to assume some level of maturity. And these cells are seen to be bigger or larger than the lower parabasal and also the basal layer, which shows that they are beginning to assume some form of maturation. Then if you go more superficially, you have the superficial layer, and this is what is carved out here in yellow. This superficial layer, the cells that are embedded within the superficial space are larger and are broader. And at this point are at the mature level. And this maturity is influenced greatly by hormones. So generally, the stratification of the squamous epithelium varies in thickness as we age. During menopause, the thickness of stratification is reduced in menopause. And also during proliferative phase of the menstrual cycle, the superficial layer is seen to be thick, containing large number of mature cells, and this is under the influence of estrogen. So you see that at different stages of reproductive life and also at different stages of the reproductive cycle, the stratification level is different. So let's go to the transformation zone. We say that the transformation zone is a point where the mucosal lining the endocervix becomes transformed into that of the exocervix. And remember, we already established that the endocervix is lined by a simple columnar type of epithelium, which is continuous with epithelium lining of the uterus, while the exocervix is lined by a stratified squamous type of epithelium, which is continuous with the epithelium lining the vaginal canal. So at the point where this transition occurs is where we refer to as transformation zone. So if you look at this upper image, we already have the cervix here carved out in green. And at this upper region is the endocervix. At this lower region is the ecto or the exocervix. We also have the mucosal lining of the endocervix here highlighted in white. We have the mucosal lining the ectocervix or the exocervix here highlighted in blue. So at this point where the mucosal lining the endocervix becomes transformed into the mucosal lining of the ectocervix is where we have the transformation zone. If you look at this lower image, this is the histological section of the mucosal lining of the cervix. And specifically, this region is where we have the transformation zone. This region that is harrowed here in black is the transformation zone. If you look at this region, we have simple columnar type of epithelium, and this shows that this is the region of the endocervix. Where at this region, we have the stratified squamous type of epithelium, and this shows that this is the region of the exocervix. So at the point where we have a transition between the mucosal lining of these two sub-regions is where we have the transformation zone. And this is what is harrowed here in black. We also try to use this lower image. This is where we have the transformation zone here, harrowed here at this point. You see that at this point, the mucosal lining the endocervix, which is a simple columnar type of epithelium, changing into the stratified squamous type of epithelium. So this is what is referred to as transformation zone. And the mucosal lining this region also is different from the other two sub-regions, because at this point, cells are now beginning to be transformed into another type of cell. If you look at this image at the central region, this image here is the ectocervix or the exocervix. This is a region of the cervix that extends into the vaginal canal. So deep to this region is where we have the endocervix. So this region that is projected here in this image is a region of the cervix that is seen to extend into the vaginal canal. We say that the transformation zone is a point or region where the stratified squamous epithelium is transformed into a simple columnar type of epithelium. And this region is also referred to as the squamocolumnar junction. The squamocolumnar junction, if you break down the name, is a junction where we have a squamous type of epithelium and a columnar type of epithelium. So this junction is what is referred to as the squamocolumnar junction. And this squamocolumnar junction is usually seen before puberty at the level of the external os. If you take a look at this upper image, this is where we have the transformation zone here, harrowed in yellow. And this zone is seen to tally with the level where we have the external os. This is where we have the external os, and this is where we have the internal os. Remember, we already described the internal os and external os in our previous slide, marking the superior and also the inferior limit of the endocervical canal. This is where we have the endocervical canal here, and superiorly it is guided by the internal os, while inferiorly it is guided or limited by the external os. So at the point where we have the external os is what tallies to the transformation zone. And this is seen before puberty. After puberty, there is a change in the position of the squamocolumnar junction, which is the transformation zone. This is where we have the exocervix. This is the region of the cervix that is seen within the vaginal canal. And if you look at this region here, this is where we have the squamocolumnar junction. This is the squamocolumnar junction before puberty. This squamocolumnar junction after vaginal birth is seen to change. At this point that is harrowed here in white, will then be tagged as the old squamocolumnar junction. If you look at this region here that is carved out here in dotted red, you see that there is a portion of the endocervix that is protruding out into the vaginal canal. And this is exposing the simple columnar epithelium that is located or lining the interior wall of the endocervix into the vaginal space. And because of this exposure into the vaginal acidic environment, the simple columnar epithelium is seen to be transformed also into the epithelium lining the vaginal canal. And at this region here that is harrowed in pink is where we have the new squamocolumnar junction. This is seen in women that have given birth because of the elongation of the cervix. So this original point that is harrowed here in white is the old squamocolumnar junction, while this new point that is harrowed here in pink is the new squamocolumnar junction. And this occurs as a result of the elongation of the cervix that occur during vaginal birth. So you see that the space between the old and the new squamocolumnar junction will then be referred to as the transformation zone, because this space between these 2 points is a region where you have cells undergoing some form of transformation. And this is why it is so referred to as a transformation zone. So you see that the squamocolumnar junction before puberty and also after birth process are different. This is as a result of the fact that the cervix is subjected to elongation during vaginal birth process. But ordinarily, before puberty, squamocolumnar junction is seen to tally at the level where we have the external holes of the cervix. The transformation zone is a common site for abnormal cell growth. Remember, we said that there is going to be a transition of simple columnar epithelium into stratified squamous type of epithelium. Because of this transformation, there is a possibility of abnormal cell growth in this region, and this can lead to cervical dysplasia or cervical cancer. This is also an ideal site of cell collection during pap smear, because at this point is where the cells that have the capacity to be transformed into abnormal cells are seen. So you see that the mucosal lining the different subregions are different. For the endocervix, it is lined by simple columnar type of epithelium. For the exocervix, it is lined by a stratified squamous type of epithelium. And the transformation zone is seen as an intercept between these 2 subregions. So at the transformation zone, you see cells transforming or changing from one form to the other. So this is the basics of the mucosal lining of the cervix. And we try to relate it to the different subregions of the cervix. Thanks for watching this video. Let's continue to stay tuned.